Good morning everyone. My name is Saswati Sudhir Nagarkar and today I am going to speak on topic muscles in Yogasana in front of you. So first asana is Tadasana. Tadasana consists of erector spinae muscle. So erector spinae muscle, the origin of the erector spinae muscle is the posterior part of the iliac crest, posterior surface of the sacrum and sacroiliac ligament and sacroiliac ligament and spinous process, supraspinous process. The is insertion of the erector spinae muscle is uh, angle of ribs. त्यानंतर processes of cervical and process transverse processes and spinous processes of cervical and thoracic vertebrae. So the blood supply of the erector spinae muscle is the blood supply of the erector spinae muscle is posterior branches of intercostal arteries, subcostal arteries, त्याच्यानंतर intercostal arteries, subcostal arteries, occipital arteries, lumbar arteries, deep cervical arteries. The nerve supply of the erector spinae muscle is the nerve supply of the erector spinae muscle is um, the nerve supply consists of posterior ramus of spinal nerves and the actions of the erector spinae muscle that is present here, that is the action of erector spinae muscle is nothing but about the bilateral and unilateral actions. So bilateral action consists of bilateral action consists of bilateral action involves standing, maintaining the posture of the body, and also it helps in extension of vertebrae and the neck, and it also the helps in unilateral movement helps in bending and upliftment of the spine and sideward bending of the vertebral column and the spine. So the erector spinae muscle is completed. Then the next muscle is quadriceps femoris. So you can see here the quadriceps femoris muscle. So quadriceps femoris muscle consists of four muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So vastus lateralis, rectus femoris first is anterior. It originates from the anterior inferior iliac spine, and that is AIIS, and also the anterior surface of the ilium, and the vastus lateralis extends from the originates from the it originates from the uh, lateral lip of lateral lip of linea aspera of femur, and the lesser greater trochanter of the femur, and the this one the uh, vastus medialis. It originates from the intertrochanteric line of the femur and the intertrochanteric line of the femur and the uh, intertrochanteric line of the femur and the medial lip of linea aspera, and the vastus intermedius originates from the anterior and lateral surface of the this one femoral shaft. Then the origin is over. Then insertion of the quadriceps femoris. So insertion of the quadriceps femoris is nothing but all the four muscles, that is rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius, come together and unite together to form a quadriceps tendon, which then attaches to the base of the patella, and this continues to as the patellar ligament into the tibial tuberosity. So this is the insertion of quadriceps femoris. Then after insertion there is blood supply. Blood supply of the quadriceps femoris consists of it involves the this one, no, quadriceps. No, these are hamstrings. Quadriceps femoris is inside the hamstring muscles. That is, the blood supply will be femoral artery, lateral circumflex femoral artery, and lateral circumflex femoral artery, and the deep femoral artery, that is profunda femoris. Then the blood supply is carried over. Then afterwards is the nerve supply. Nerve supply of the quadriceps femoris is nothing but the femoral nerve, that is L2 to L4. And actions of the quadriceps femoris are flexion, extension, flexion of the knee joint, and flexion of the hip joint, that is this one, and extension of the knee joint. Extension means this one, extension of the leg at the knee joint. The next muscle is gluteus medius. So gluteus medius muscle is present at this portion of the thigh. Now the thing is that the origin of the gluteus medius is the exterior gluteal surface of the ilium between the anterior and posterior gluteal lines of the anterior and posterior gluteal lines of the iliac crest, and behind the, just below the iliac crest, and insertion of the gluteus medius is nothing but the lesser trochanter of the femoral shaft. Lateral surface of the greater trochanter of the femoral shaft. It's not lesser trochanter, it is greater trochanter. Then blood supply of the gluteus medius. So gluteus medius blood supply will be nothing but blood supply of the gluteus medius will be surely popliteal artery. That, no, sorry, gluteus medius. Popliteal artery will be for gastrocnemius. It will not be for this one, gluteus medius. The blood supply of the gluteus medius will be for sure superior gluteal artery, which is main supply, and which is contributed by small branches, or deep branch, not small branch, deep branch of the inferior gluteal artery. And then the nerve supply of the gluteus medius. Nerve supply of the gluteus medius consists of the gluteal nerve, but it is superior gluteal nerve, L4, L5 and S1. L4, L5 and S1. And actions of the gluteus medius are nothing but abduction of the this is adduction and this is abduction. So abduction is away from the middle line of the body. So abduction of the thigh at the hip joint. Medially rotate the thigh, and also it stabilizes the pelvis of helping into stabilizes the pelvis while walking and standing on one leg, and also helps in while walking in on one leg, and prevent it from dropping on the opposite side, unsupported side. Next muscle is gastrocnemius. You can see here the gastrocnemius muscles. So gastrocnemius muscles, origin of the gastrocnemius muscle is for sure about the knee. It has actually, first of all, gastrocnemius. So gastrocnemius has two parts, that is lateral head and medial head. So lateral head has first medial head. I'll explain about medial head. So medial head has it is like medial head consists of posterior surface of medial femoral condyle, and adjacent popliteal surface, and the lateral head consists of this one, lateral surface of lateral femoral condyle, and also it tells us about the lateral surface of lateral femoral condyle, and also about the adjacent supracondylar area. Then the insertion of gastrocnemius. So what is the insertion of gastrocnemius? So the gastrocnemius gets inserted into the this one posterior surface of the calcaneus bone, which is the heel bone, and it is via the calcaneal tendon. Blood supply. Blood supply of the gastrocnemius is for sure the tibial nerve. Sorry, nerve supply not. Blood supply. Blood supply is sural branches of the popliteal artery. Sural is the word used for the calf muscles. Arterial supply. It's the popliteal artery. Nerve supply is the tibial nerve. And actions of the gastrocnemius are plantar flexion and plantar flexion at the ankle joint, and raise up the heel during walking, and also one more thing is there, flexion at the knee joint, flexion at the knee joint of the leg at the knee joint. Next muscle is the tibialis anterior muscle. So tibialis anterior muscle consists of anterior. First of all, we see the origin of the tibialis anterior. Okay, so origin of the tibialis anterior. First of all, it consists of it is originated at the lateral surface of the tibia, that is upper lateral surface, lateral condyle, and upper 2/3 part of the tibia, and also it is upper 2/3 part of the tibia, upper 2/3 part of the lateral surface of the tibia, and adjacent interosseous membrane, deep fascia, and intermuscular septum. So insertion about the tibialis anterior we are going to see. So insertion about tibialis anterior is nothing but the it gets inserted into the medial cuneiform and base of the first metatarsal. And blood supply of the tibialis anterior is nothing but the tibialis anterior is nothing but the blood supply of the tibialis anterior is according to its name, it is anterior tibial artery. Okay, so nerve supply of the tibialis anterior is nothing but the nerve supply of tibial artery will be nerve supply of the tibialis anterior will be peroneal nerve. This is deep fibular nerve. It is L4, L5. One more thing I have shown L4, L5 here. I'll show you. This superior gluteal artery is also L4, L5 for us, and fibular nerve is also L4, L5 for us, and femoral nerve is L2 to L4 for us. So that is just the revision for the nerve supply. Easy for us. Okay, then action of the tibialis anterior. So action of the tibialis anterior has dorsiflexion action of the ankle joint. That is this is plantar. This is dorsiflexion action of the ankle joint. It involves the usage of these muscles, that is tibialis anterior, that is shown here. This muscle. So and also helps support the medial longitudinal arch of the foot. Then is the Vrukshasana. It is performed like this, with one standing on one leg, taking the right leg at the thigh and just stretching the arms in arm span, and then afterwards taking the hands upward. So this is the Vrukshasana. So Vrukshasana consists of the gluteus maximus muscle. So in that, the origin of the gluteus maximus muscle is it's all about the posterior gluteal surface of the ilium and the dorsal surface of sacrum and coccyx, and it is all about the sacrotuberous ligament and thoracolumbar fascia. Okay, so insertion of the gluteus maximus of Vrukshasana, means for Vrukshasana, gluteus maximus or insertion would be it would be the greater trochleus. No, now see, the insertion has two things. Means for gluteus maximus, it has two things: upper fibers and lower lower fibers. So upper fibers are attached to the iliotibial tract, and the lower fibers are attached to the gluteal tuberosity of the femur. Then the blood supply of gluteus maximus will be here inferior gluteal artery. Now when we learn two muscles, gluteus medius and gluteus maximus, at that time gluteus medius has the blood supply of superior gluteal artery, and the gluteus maximus has the blood supply of inferior gluteal artery. So main supply differs. So we have to remember at that point of way, or at that with that way. And also there is superior gluteal artery which is having the supply. Nerve supply for gluteus maximus would be gluteal nerve, but it is inferior gluteal nerve. But for the superior gluteal artery, for the gluteus medius, you have superior gluteal nerve as the nerve supply. But here, as we are learning gluteus maximus, it will be for sure the inferior gluteal artery, inferior gluteal nerve for the nerve supply of the gluteus maximus. And then we'll learn about the action of the gluteus maximus. So gluteus maximus is nothing about, it extends the thigh, the hip joint, laterally rotates the thigh and assists in rising through sitting position and stabilizes the hip and knee at the iliotibial tract. Next are the hamstring muscle. You can see here how they are placed. Okay, so hamstring muscle consists of bicep femoris, semitendinosus and semimembranosus muscles. So bicep femoris, origin of the bicep femoris long head is ischial tuberosity, and the short head is this one, linea aspera, and lateral supracondylar line of femur. The semitendinosus origin is ischial tuberosity, and semimembranosus origin is also ischial tuberosity. And the insertion of the hamstring muscle would be, bicep femoris would be attached to the head of the fibula, and the semitendinosus muscle would be attached to the upper medial surface of tibia. Semimembranosus muscle posterior surface of medial condyle of tibia. Blood supply would be for sure profunda femoris artery, because hamstrings are located here, and this jogging exercise helps better into the hamstring muscles. So nerve supply is tibial division of sciatic nerve, semitendinosus, semimembranosus, and long head of bicep femoris, common division of the sciatic nerve for short head of bicep femoris. Action: extend the thigh at the hip joint, flex the leg at the knee joint, medially rotate when the knee is flexed, semitendinosus, and laterally rotate the leg. Okay, so extend the thigh at the knee joint, flex the leg at the knee joint, extend the thigh at the knee joint means like this, flex the leg at the knee joint means like this, medially rotate the leg at the knee joint means medially rotate the leg at the knee joint so it is medial means like this, medial rotation of the leg. Okay, medially rotate the leg when the knee is flexed, and semitendinosus and semimembranosus, and laterally rotate the bicep femoris. Thank you.